Hello, lovely. How are you? Good. Nice to meet you. I'm Dr. Nicola, and I'll be carrying out your skin assessment today. How have you been? Oh, that's good. Did you have a nice holiday season? Oh, I'm glad to hear it. I did, thank you. Thank you for asking. So, my love, I've been talking to one of the colleagues here, and they said you are concerned about sudden redness and breakouts, is that right? Okay, I can see exactly what you mean. It's all like here, isn't it? And when did you notice? Okay, so bit by bit. Yeah. Okay. To be honest with you, I see this quite a lot this time of year. Yeah, with it being, the holidays, Christmas, and things like that. People tend to eat a lot, consume a lot of different foods like cheese, chocolate, and then things like alcohol, extra caffeine, and all sorts of things like that. And it comes out on the skin. Yeah, and it has been quite cold recently. We've had a bit of snow, a bit of ice. Then, I've had minus temperatures. We've been indoors a lot, heating on. And then people tend to get sloppy with removing their makeup before bed, following their skincare routines and things like that. And I'm sure you fall into some of those categories, don't you? Yeah. So that is probably what's going on, my lovely. Okay, so you've had acne before. Oh, my love. Okay, so you're concerned about that. Oh, all right. Just by looking at you, I wouldn't say it is acne, but I will have a look to see if anything is starting. How old are you? Okay, and when did you experience acne? Okay, so that is quite some time ago. The chances of it coming back now, probably not a lot. Yeah. Do you have any scarring? Yeah, I can't see anything obvious just by looking, but I will have a close look. Okay, and your face does actually appear quite red all over. Is that normal for you? No, okay. Interesting. It does appear to be irritated. Okay, so you've had past acne, okay, and you have scarring, okay, on your cheeks, yeah. So I think you've got post-holiday skin / winter skin, maybe. Okay, your face is red and breakouts in like a V and down. Okay, that's fine. And we have a mix of white heads and slight lumps. Just by looking, I can't see any obvious like boils or any large cysts or anything like that, which is really good. Okay. And I can't really see any blackheads either. The area doesn't look too oily. It does have a bit of a greasy shine, but that could be to do with the time of day. Does it look like that all the time, or is it after? Yeah, okay, right. Could be due to dehydration rather than, excess oil. Okay. It's quite a hormonal place as well, and a lot of like food related places. Okay, so your skin feels quite tight. Alright, tight. Any itching or anything like that? Okay. So I'm guessing your skin's quite dehydrated. if I'm really honest with you. A bit of mix of everything, you know. Now, just to let me know, what kind of things are you eating over the holidays? Mm-hmm. 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 Okay, what about drinks? Uh-huh. Okay, it's not a lot of water. What do you like with water normally? So. Okay, but worse now. Okay. Okay. What type of skin would you say you have normally day to day? Yeah. Okay, do you use skincare at home? Okay, can you tell me what you use? Okay, so it's not too bad. And what brand? Okay, that's fine. Okay, let me just have a look. Now, I don't know what your under eyes are like normally, but you do have quite a bit of a dark circle. Is that normal? Okay, so it's a lot more prominent than normal. Okay, it could be due to sleep cycles, again, drinking and caffeine and different foods and that. Okay, so not circles. Much worse. Okay, you don't have any puffiness under your eyes, so that's good. That's also another thing that's quite common this time of year. Under your eyes look okay. Now, so what is your overall concern? Okay, yeah, all right. And what are you hoping to achieve? Good, yep. Okay. So you want nice balanced skin, okay, hydrated, nice and clean and healthy. Okay, that's fine. Right, if you could smile for me. Do you feel any tightness or anything? Okay, now could you frown? Any tightness or anything? Okay, raise your brows. What about now? Okay, and relax. Can you close your eyes? Open. Can you scrunch your face? Okay, so that feels a little bit tight. Okay, relax. Can you just open your mouth for me? And just make a chewing action. Okay, relax. When you were doing certain expressions, I could see like creasing in the skin, but it looked quite dehydrating rather than lines. Alright, okay. Yeah, I mean, possibly a little bit under your eyes, but it's very difficult to tell at kind of this time of year, really, especially after the holiday season. But I will be having a look for you, so I'll be able to tell you exactly what's going on. Alright, okay. Right. Is it okay if I touch your face? Thank you. What I'm going to do first is just take a couple of samples of your face as it is now. Okay? I don't want to do it before I start touching. Okay, my love. So, let me just get a couple of things. Okay. Are you ready? Okay, what I'm going to do is just take a swab of all of your face, if that's okay. Okay, I'm going to start here. And just under your eye. Okay, thank you very much. Okay. Okay, now this one is just for the area that is got the breakouts. Okay. Okay. Okay, that's that and that one. I'm now going to just check your oil production. Okay. There is a bit of excess oil there. Okay. Your chin was okay actually. Okay, so this side. Yeah, it's definitely some there as well. Okay. Okay, your nose. Yeah, there's definitely quite a lot there. Okay. Okay, let's do your forehead. Okay, so your chin and your forehead are probably the least oily part. Here and here is obviously the worst, alright, and on your nose. But it's quite common to have your teeth section quite oily, but you've got a little bit of oil in this section, but that coincides with your breakouts, okay? You alright? Good. Okay, I will have a feel of your face in a moment. Okay. I'm gonna get my light first. Just have a look. Yeah, it does look quite red. A bit angry. Okay. I'm just going to have a look at my purple light. Okay. When was the last time you exfoliated? I can tell you've got lots of dead skin all over. Yeah. Now, this also shows sun damage that's deep within. You do have some of that, my lovely. There's not really anything visible on the surface, okay, and you don't have any pigmentation or anything. But with this light, I can see that you've been burning here and on your nose area, alright, and a little bit above there, your cheeks, okay. Just make sure you are wearing SPF, okay, my love, just to prevent any further damage, okay. And if we can try and repair our skin barrier, that's really going to help as well. I'm going to do now is actually start examining your face, okay? Start on your forehead. Is dehydrated. Not excessively, but it is a little bit, okay. This here is a slight fine line, yes, but your forehead is quite dehydrated, so it actually looks worse than it is. When I squeeze it, it kind of cracks off, more like a bar of soap, which is where you're dehydrated, okay. No, I wouldn't suggest filling that out, my lovely. It's so fine that that's not going to do anything. Now, you could go down the route if you really want to have a tad bit of Botox there. That would just help smooth that line out a little bit and prevent it from getting any worse. But, in all honesty, it looks fine. Okay. Just smile for me. No, my love, you don't have any lines there. Not this side anyway. Okay, relax. That slight little bit there's a slight little crease, but it's more on your eyelid than where you would get your fine lines and wrinkles. Okay. Bit dehydrated though. Okay. Just close your eyes. Okay, open. I will feel without my gloves a little bit later, but it does feel slightly dry, like it's pulling a little bit on my gloves. Okay, now I'm going to gently just squeeze, okay? Okay, you can close. Okay, open. Definitely dehydrated there, my lovely. Alright. I mean, you've got a slight fine line, but that's minimal. But when I'm squeezing, it breaks off, and that's when you're dehydrated, okay? And obviously your darkness is like here. It doesn't look like it will stay like that, if I'm really honest. Okay. Right, let's go on this side. Okay, smile. No, same as the other side, my love. Okay, relax. Okay, close your eyes. Okay, open. The dark circle is very similar to the other side. Again, I think it's dehydrated. It's pulling slightly on my glove. Just squeeze. Okay, just close. Okay, you can open. Yeah, so your under eye is definitely dehydrated, my love. And that's going to be making any fine line more prominent. Okay. Okay, so let's go between your brows. Brows feel smooth. Right, nose, let's have a look. A bit of a shine to there. Some blackheads and a few enlarged pores as well. Okay. Squeeze. Okay, around the edge there. Some broken capillaries. Do you normally have that? Okay, yes, but not so bad. Again, that is quite common with a cold, or if you've got a cold and you're blowing your nose, it's popping them, or at different temperatures, you're rubbing your face a lot, and also like drinking and different things like that can cause that and make it worse. Okay, again, that is quite common this time of year, and you can get it on your cheek areas. Alright, but I will have a look at that in a moment. Okay, but your nose does appear quite smooth, which is nice. Okay, let's have a look at your upper lip. Smooth, there's nothing of concern there. Alright. Yeah. So your chin, sort of a mix of things going on here, alright? It's very red, very tight, dehydrated, and it's appearing to be greasy. And then you've got some breakouts, which, the way it appears, I would be surprised if there wasn't any. Okay. I can feel under the surface that some breakouts deeper down that have not come up yet. I know that's not what you want to hear, but I can definitely feel that. Okay. Okay. Yeah, it's sore, isn't it? Okay, I'm just going to be squeezing, alright, my lovely? Yeah, you're definitely dehydrated. And that's where you've kind of got that mix of dry, tight feeling, but also like a greasy shine. Alright. Let me just feel. You can see some of your scarring. I've seen a lot worse. There's quite a few things that we could do actually over time to help with that, if that's something you were really, concerned about. But it's the scarring's very much here in this position. Alright. Yeah, it's the same. Yeah. Just stretch out a bit. Okay. Yeah, that's definitely not acne. And as it stands at the moment, I don't see it turning into that. My swabs will do, confirm all that. Alright. But I wouldn't say that you need to be worrying about that. It's definitely more environmental and from what you've consumed. That's what I believe that to be. Alright. But it means we need to work on it. Okay. Squeeze the cheek area, okay. Is that feeling okay, my lovely? Good. Just chin. Okay, now just your forehead. Okay. I'm going to have a look with my magnifying glass, okay? I'm just going to have a look here. Yeah. Can definitely see little breakouts. They're not quite developed into anything yet. And then obviously I can see bigger breakouts. Let's have a look. Yeah, I can just see the same. Okay. Let's have a look at your chin. Yeah. Let's have a look at your nose. I can see blackheads a little bit deeper in. Okay. And some more enlarged pores. They're not as enlarged as the ones I can see without the magnifying glass. Just have a look in your eyes. Yeah. A little of the dark circle there. Looks quite smooth closer up. Okay. Okay. Just have a little look at your forehead. Lovely. Okay. I'm just going to jot some notes. Okay. So, your skin is looking quite dull, okay, quite fatigued, a bit tired, a bit dehydrated. Well, I say a bit dehydrated, a lot dehydrated. Yeah, that's right. That's not helping the situation. And it's definitely irritated, a bit inflamed with it being red, and then obviously your breakouts. Okay, so your skin is just purging at the moment, my lovely, from everything that you've consumed over the last few weeks, and it's just coming out. Okay, the good thing is it is coming out. It's a way of, detoxifying you. So that's a good thing, but obviously it can make us feel a little bit uncomfortable. Now, in this situation, I would make sure you are double cleansing, okay, and really, get into your skin, nothing too harsh, alright, and make sure it's hydrating. Some nice gel or something like that, okay. Now you must exfoliate at least twice a week at the moment, nothing too harsh, okay. Something nice and gentle would be really nice, okay. And put on some hyaluronic acid. I think we need to add that into your routine, especially at the moment, just to help boost the hydration, okay. Yeah, and if you pop that on like at the beginning of your routine, it's really going to help everything get locked in, so that'd be really good. Okay, yeah. Now, an eye cream is essential, so make sure you are doing that. It's really going to help hydrate the under eye, and you can get some with caffeine in, help with any puffiness and dark circles. All right, yeah. Okay, and make sure you're drinking plenty of water. Really get that water in you. All right. Yeah, I think that's really going to help. And then we're going to be using a good moisturiser, all right, my lovely. Now, you don't need to go out and use anything harsh or anything designed for acne or anything like that. Okay, we just need to watch what we are doing. I'd recommend maybe using some light therapy. That'll be really good for you at the moment. Yeah, and a bit of blue light, a bit of pinky purple light, maybe even a bit of red light. It's really going to help, okay? Something like that will be good. Maybe even like a deep hydrating hydrofacial, or a little bit of suction as well. Dermaplaning maybe too, but we can't do dermaplaning when you've got active spots, but down the line we could. Same with microneedling down the line. Now, this shouldn't last too long, if I'm really honest with you. How it looks at the moment, you could probably over the next month start to see it reduce, but you need to change a bit of your lifestyle as well to help that. So make sure you are removing your makeup, maybe even give your skin a little bit of a break from makeup, and if you are wearing it, make sure you're cleaning it off properly and use a good micellar water, and then maybe like a double cleanse as well. I suggest that you use a hypochlorous solution, and that will help fight any bacteria and help with breakouts and things like that, as would the light therapy. Obviously the light therapy, it's going to be an investment, something that you could be using permanently. I like to use the shark mask. It's very good. There's a blemish setting, there's under eye coolers as well, which is brilliant, a sustained setting, and there's an aging setting. Somebody like you, especially at the moment, would benefit from the blemish setting. It's very good. There's also like a facial pro that they do, facial glow pro, and that sucks out all of the dirt and things, and then you can also pump in some hyaluronic acid. That'd be really good for you. But why you've got some of these really active spots, we can't really use it on that area. All right, yeah, and I think we just need to stop touching the skin and use a silk or satin pillowcase. Okay, maybe like something like this. When you are washing your face, dry them with this. So these are like ultra soft sheets for, they're cotton cleansing towels basically, and you recycle them, something like that, or ones that you can wipe, but make sure you are changing them like day to day. Don't just leave them for a couple of days. Okay, make sure your makeup brushes are cleaned as well. I'll keep on top of that. Nothing too hot on your face, okay? Avoid anything like steam room saunas, and try to get back into having a balanced diet, and balance with your drinks and things like that. Okay, yeah, I mean, I don't know what your lifestyle is day to day normally, but if your skin was fine, you can sort of go back to that, if obviously that is working for you. Yeah, and I would say we could do some like hydrating masks on your skin as well. Once you've exfoliated, pop on a nice sheet mask or something hydrating, nothing too harsh. All right, and then we're just going to let the skin do its job. All right, I mean, you could be popping on some spot cream, something like maybe a salicylic acid serum or something. Maybe niacinamide will be quite nice for you. Maybe you could get hyaluronic acid with niacinamide in. That might work quite well for you. All right, I have some products in mind, so if it's okay with you, I could come up with a regime and suggest different products, different price bands, and then send it to you, and then you can get what you want, if that's all right. I don't mind doing that for you. There's so many things to go through. It's better for me to do it when I do your report. So let me just take my gloves off a moment. I want to feel your face. Just let my hands dry a little bit. So I'm happy with that. Your skin is actually, you know, okay. It would be healthy if it wasn't for all this. You know, your barrier feels quite nice. That's why I don't want you to use anything too harsh on your skin, thinking, oh my god, I'm going to get it off, I've got acne, because you're going to damage your barrier and then we're just going to go just worse. Okay, so please don't do that. Let me just feel. Okay, now let me just pull. Okay, it's not too bad. Okay, you can really feel the breakouts. Yeah, definitely got that greasy feel. Yeah. 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 Definitely dehydrated. It's not that damaged, my lovely, no. This is just a temporary thing, okay? Yeah, it's definitely your skin just purging. So I'd avoid anything like retinol or anything like that's going to make your skin turn over too much. If you do get something like the sharp mask, avoid just the red light setting, which is the anti-aging one for now, because it's going to help collagen turnover and things. We don't want to do that. That's why the blemish setting will be perfect. Or have a look on the market, see if there's something in like a cheaper price range. All right. Yeah, and just look after your skin, my lovely, okay? With this time of year, you know, you can cover your face up maybe with a scarf. You can use a thicker moisturiser to help keep your skin nice and supple and hydrated and just protected, you know, protect your skin barrier. That's really going to help. Now, the redness, that should go down, my lovely, okay? Yeah, it just is a little bit irritated. So have you been using anything? You've been using harsh stuff, haven't you? I thought you might have done. That's probably why it's gone like that. Yeah, yeah, don't use that too much. Okay, I know. It's all right, it's fine. And you haven't done any damage, my lovely. All right, just ignore that. Don't use those, okay? Go back to what you would normally use, all right, but add in some of the things that I'm going to recommend for you. And I will obviously recommend a full range and better products and things like that, and you can just do what you like, but that's really going to help you. All right, and just, you know, chill out. If you start stressing about it, that's actually going to make it worse. All right, so we're just going to remove the dead skin, hydrate it, give it moisture, and give it that water, you know, clean our skin properly, make sure everything is off our skin and stop touching, and, you know, don't use a cotton pillow or anything where you're going to be just putting your bacteria in. It's going to be, you know. All right, are you okay? Good. Does everything I've said make sense? Okay, so it literally is just to, you know, after holidays, I see this a lot. Now, I'd say see how you get on, and if for whatever reason it's, you know, getting worse, now you must leave it at least a month. Skin's got to turn over, it's got to purge, it's got to work its way out. Okay, so start with things that I'm going to recommend for you. Leave it for about 2 months, 2 to 3 months, and if it is starting to get excessive and it's changing and things like that, even in between that, please contact me and then I can have a look. I will be checking all these swabs. If they do come back that it's looking like acne could be present, then I would get you in and start treating that. All right, but I don't think it's going to do that, if I'm really honest, but I do like to check. Okay, and if for some reason, you know, it is, then I can treat that before it gets worse. All right, but monitor it, do the things I've suggested, and, you know, hopefully your skin will be back to normal. All right. Do you have any questions? Okay, well, if you do think of any, please contact me. Alright, so give me about 4 days to do the report and recommendations, and I'll email it to you. Can I just take that? I know, I think I have got it, but just to be sure. Thank you. Wonderful. Great. Can I just double check your number as well? Okay, just be on the safe side. Okay, so if I am concerned about anything, I will ring you, but I will definitely email you with all the info. Okay, well, it's lovely to meet you, and I hope you have an amazing 2026. You take care now. Bye bye.